Tonight, we honor those who keep our medical community running strong. The exceptional level of healthcare throughout our region would not be possible without its knowledgeable, passionate nurses. It's our hope that these awards can help recognize a field that's all too often overlooked. To help highlight these outstanding professionals, we asked a distinguished selection committee comprised of respected leaders from such organizations as the Mayo Clinic, Johns Hopkins University, the University of Missouri, the Missouri Nurses Association, the Nurse Practitioner Healthcare Foundation, and the Get Well Network to review the candidates. Together, they scored more than 200 nominations and helped select 61 finalists across 16 categories. These nurses bring grace and compassion to a job that can often be stressful and demanding. They're able to connect with patients during trying times, and that's something that stays with patients and their families for years to come. For that, we say thank you.
At Mercy Children's Hospital Cleft and Craniofacial Deformities team, we see patients that have been born with a variety of birth defects, basically from the head up. I love to see the beginning, the middle, and the end. We see them actually before the child is born, often when the mother and the father have received a diagnosis intrauterine through an ultrasound that their child has a craniofacial abnormality. So that's oftentimes our first meeting of the family. So I love to be able to meet with those families and help them journey through the process of the devastation that something is wrong with their child that they weren't expecting, and being able to then watch them graduate from our team, and also being able to share the different joys as they go through life. They share those moments with us, and it's like having another family and seeing and being able to share in those joys.
She doesn't really, I think, interact with the kids as a vertical, hierarchical healthcare professional, but more trying to get them to feel like she's maybe some distant relative that they didn't remember, but that somehow she belongs in the family, and to accept her as that. And then being there as a support mechanism, really 24/7. So she gives the families her phone number, she gives the families her email, she lets them know that she's available. Again, that's a great benefit for me, because she really is the first line. And they use her.
Bye-bye. Bye, Miss Lila. Bye-bye. It just is what keeps me alive and on fire, basically.
I always wanted to be a nurse, even from the time that I was a little bitty girl and dressed up in nurse costumes, read all the nurse books. I see patients for 6 or 8 hours most days, and I have a bookcase from floor to ceiling that has all these heads with all these different kinds of masks on it that can be intimidating to patients, or they can say, wow, look at all those different masks. It's because you have a different face from you, and we have to fit the right mask. I don't even have them all. I have a lot, but not all.
We hear a lot of good stories about Patty. We tend to send her our more difficult patients. Difficult meaning they're really struggling even despite our best efforts. The reason we do that is we think she's very effective. She's really helped a lot of them get their life back in order. Really, if she can get them sleeping better at nighttime, it not only helps them function better during the daytime, but their families and their friends and their coworkers. And so it really makes a tremendous difference in their life.
When I go into a patient's room, I always say, I'm the clinical educator, and they always look at me like I have 4 heads because they don't know what that is. But then I explain, I do all the training for the nurses and the PCTs on the floor. So a lot of times I'm just the communicator. I communicate different things that are changing within our organization. I communicate different opportunities that the nurses have to grow. I kind of view myself as like the nurse's nurse. I'm trying to give them the tools and the knowledge and the expertise they need to shine.
She is someone that is very driven. She has very high standards for herself, and she brings a lot of creativity into the nursing education, which I think is really fun for the learner.
What I tell them before every simulation is, what makes a great nurse is someone who can have a really bad day, who things don't go right, you have bad things happen, but that great nurse is someone who can take that bad day and not be crushed by it, but learn from it. They love simulation. They love it.
NurseWise is a 24/7, 365 medical triage company, so we have nurses who are available around the clock to answer members' calls when they're experiencing medical symptoms. All day, every day, 24 hours a day, we're talking to members who have a medical symptom. They don't call because they're having a good day, they call because they have an issue or a question or a concern, and we're able to help them work through what do they need to do next about that.
Even though we are in a more of a business setting at this point, I still see the nurse inside of Kim. She wants to stay very connected because what we are doing is providing nursing care. It's just not the typical hands-on care that people most frequently think about when you think about nursing.
When I first got out of nursing school, we still wore our white hats. So, things have changed a lot.
That's another thing that's really amazing about the nursing profession, is that you can do anything you want and be good at your niche, For me, it just happened to be the intensive care unit. Kind of when I was in that 14 to 16 year range, my grandfather was sick, had some heart issues, and was kind of in and out of the ICU. And he had some really cool male nurses, and it's kind of the first time that I thought, because I loved science and I loved kind of anatomy and stuff like that, that nursing even was an option.
Chad has the ability to establish a relationship with the patient. He has a very calming presence. He listens, and he is able to establish a relationship that is meaningful. He is never rushed. He takes the time, like I said, to listen, and he helps support them through whatever it is that they're going through. And in a high acuity environment like an ICU, there's lots of emotions, there's lots of questions, there's lots of concerns, and he has the ability to approach them in a very calming manner.
I think that one of the best parts of my job is being able to console and kind of help educate family members who are kind of seeing their loved one in a very sick state, and being able to kind of walk them kind of through, what hopefully they're going to see and improvements. And and while I say that families sometimes are the best part of my job, they can also be one of the most challenging part of my job at times as well.
Sometimes when you do critical care work, it's not just for the patient. A lot of it is family work. I took out a really sick patient, ECMO, balloon pump, heart transplant, not doing well, and big family. I was able to say enough of the things to convey both the truth and comfort to them in kind of this dark moment in their loved one's life. And I could see as I spoke to them, even though they were upset, even though there were tears, that there was a moment of relief and a moment where their shoulders relaxed a little. I was able to put one of them in a room for the night, help her sleep, his wife, and I knew that's what she needed. Those moments kind of carry you, and they make some of the other moments where you're frustrated or things aren't going well not seem so important.
I've worked with Emily my entire career at Barnes. She's my comrade in arms, I mean, we have a lot of the same core values about what we think about nursing and how to take care of people, and we work well together, and she does a great job. She's a really good nurse.
I tend to tell people I'm actually not a thinking nurse, that I'm a feeling nurse, I'm an intuitive nurse, but the reality is that critical thinking is the crux of what we do. And I think that's something that maybe other people don't appreciate, people outside the profession, but we make it possible for everyone else to do their jobs if we're doing our job well.
For me, What's important is you have to speak up for those individuals that can't speak up for themselves or don't know to speak up for themselves or don't know how to. You have to be able to say, no, that's not the right thing. I think you need to do something different, and here's why I believe that.
Angela came to St. Joe West several years ago. She has a varied background. She's been a fire chief, she's been a paramedic, she's been a flight nurse. She's done a little bit of everything, and Angela comes with all of that, what we call pre-hospital experience. So she has seen it all, done it all, and so that makes her someone that we very much look to Angela to be the calm in the storm, because a lot of times she is that person.
I've been a fire chief, I've been a flight nurse, but it's all been in the realm of taking care of people. So if you know that's what you want to do it. It's really not about you just wanting to be a nurse. What do you want to do with it? How do you want to leave a legacy, and how do you plan to change the world?
My kind of pivotal moment in my career is that I decided that the type of journey that I wanted to follow my patients on was through a cancer diagnosis. Like, that was the type of journey I wanted to follow them through. When I was 7 years old, I went in for a routine checkup, and they said that they needed to admit me and that they had found a large tumor. Just the way that my parents felt and not knowing and all of that, and I remember from that point on, I was like, I want to take care of kids with cancer. And I was like, if I can make any difference, and if any child can maybe feel like this experience is a little less scary because of somebody, like, that's what I wanted to be able to do.
Jen has an amazing relationship with all of her patients and families. She can tell you everything from all the complications from their disease and treatment, on top of when their birthday is and where they went on vacation and their brothers and sisters, and she's so connected that she really brings that to the families, that they are comfortable with her, and she knows them as a whole person and not just as a diagnosis that she's there to treat that day.
To be able to go into these rooms and see a patient that you know has gotten horrible chemotherapy, they feel awful, they were up puking the night before, they've been poked and prodded, and when that patient can smile at you at 7 a.m. in the morning and say good morning to you, like, it puts everything in your life in complete perspective. And for that is all I need for this to be my driving force to do this every day. And I can't imagine doing anything other than this.
Working one Christmas, and at 2 o'clock in the morning, we were told that we were going to have triplets in 30 minutes. So that meant that we had to have an operating room available with beds available ready for 3 babies that were premature. It was a holiday, so we didn't have as much staff as we would normally have. We had to pull it together. Everyone around in the entire unit in labor and delivery, and mother and baby, and in the NICU, we all worked together to get those triplets born safely and do a great job with their care.
She is just that solid rock in the NICU that is a constant light and brings new ideas and creative ideas and really striving to see the unit be the best that it can be.
I think to be a neonatal nurse, you have to really have critical thinking, and you have to be very observant. You have to be willing to work with, since your patients cannot talk to you, you have to really be observant to look for changes, and even just subtle changes. They are so innocent and little, and they cannot speak for themselves, so you really have to act as an advocate for those patients.
New mother needs to feel valued because they're bringing a child into this world, and if they feel valued, they're going to make their child feel valued and make them feel important, and it just goes on, and they'll be successful in what they do.
Working with Kim is like working with your best friend. She is very funny. She keeps things light even in emergencies, very quick on her feet, and you know that she always has your back.
I had a laboring mom. She was kind of paced on the floor, and she was hanging on her husband, and she started pushing, and I said, oh, wait, I gotta call your doctor. And she's like, I am not waiting for my doctor. There was no stopping her. She was gonna have this baby, and she
got up in bed and she pushed out her baby. And after she had the baby, she looked at me and she goes, I dreamt that a blonde woman was going to deliver my baby. And it was you. I was wondering who it was going to be, and it was you. I dreamt about you. Her realization at that point that it was me that she dreamt about, it was pretty enlightening.
What makes a nurse awesome?
What makes a nurse awesome? Well, there's a lot of things that can make a nurse awesome.
Caring.
Thinking.
Strong. Ministry.
Confidant.
Compassion.
Advocate.
You have to be passionate.
Highly skilled, very knowledgeable.
Heart.
Patience.
Working in a doctor's office or working in a hospital or working in an emergency room or an operating room, you're dealing with people that are at their most vulnerable. And to be able to help them go through that experience with dignity and respect and compassion and understanding is the art of nursing at its best.